It's 3 in the morning and Martha sits on the edge of her bed, tears streaming down her face. Her calf feels like it's been twisted into a pretzel, and the pain is so intense she can barely think straight. She's been dealing with these brutal leg cramps for months now, and they're robbing her of sleep, her comfort, and frankly, her hope. If you've been there, if you've felt that lightning bolt of pain shoot through your leg in the middle of the night, or maybe it hits you during your morning walk, you know exactly what I'm talking about. And here's what nobody's telling you. These aren't just random occurrences. Your body is trying to tell you something important. Now I know what you're thinking. Doctor, I've tried everything. I've heard about drinking more water, eating bananas, doing stretches. Nothing seems to work. And you're right to feel frustrated. Because here's the thing that most people don't understand. Leg cramps in folks our age aren't just about being a little dehydrated. They're often signals pointing to deeper issues that, once we address them properly, can change everything. I'm Dr. John DeMarco, and over my years of practice, I've seen thousands of patients walk into my office with this exact same problem. The good news? In most cases, we can not only stop these cramps, but prevent them from coming back. Today, we're going to dig deep into the real reasons why your muscles are rebelling against you, and I'm going to share solutions that work, not just temporary fixes, but lasting relief. You see, when your leg seizes up like that, it's not just affecting your sleep, it's stealing your confidence. It's making you hesitant to take that evening stroll you used to love. It's making you worry about what might happen if you get a cramp while playing with your grandchildren. And that's not the life you deserve. What we're going to explore today could be the difference between spending your nights in pain and waking up refreshed, ready to embrace each day with the energy and freedom you remember. Because here's what I've learned. When we understand what's really happening in our bodies, we can take back control. Let me start by painting a picture you'll probably recognize. It's usually nighttime when it happens, isn't it? You might be peacefully sleeping, dreaming about something wonderful, when suddenly, bam, your calf muscle contracts with such force that it jolts you awake. The pain is immediate, intense, and for those terrifying seconds, you can't think of anything else. Or maybe yours happened during the day. You're walking through the grocery store, reaching for something on a high shelf, and suddenly your hamstring locks up. The embarrassment of having to stop and stretch in public, the worry that people are watching, it's more than just physical discomfort. Here's what's actually happening during a muscle cramp.
Your muscle fibers are contracting involuntarily, and they're staying contracted. Think of it like a rope being twisted tighter and tighter, except this rope is inside your leg, and it's not letting go. The technical term is sustained involuntary muscle contraction, but what you feel is pure, concentrated pain. Now, nighttime cramps are particularly common in our age group, and there's a reason for that. As we sleep, our circulation naturally slows down, our muscles cool down, and if we're dealing with any of the underlying causes we're going to discuss today, nighttime becomes the perfect storm for cramping. But here's what I want you to understand. These cramps aren't just random bad luck. They're not something you have to accept as part of getting older. Your body is actually trying to communicate with you, and once we learn to listen, we can respond appropriately. The difference between acute cramps, those sudden, intense ones that hit out of nowhere, and chronic cramping patterns is important. Acute cramps might happen occasionally because of temporary factors like overexertion or mild dehydration. But if you're dealing with frequent, recurring cramps, especially multiple times per week, that's your body waving a red flag. Let's talk about the real culprits behind your leg cramps, because understanding the root cause is the first step toward lasting relief. The first and most common cause is electrolyte imbalance. Now, I know you've heard about electrolytes before, but let me explain this in a way that makes sense. Think of your muscles like a car engine. For that engine to run smoothly, it needs the right mixture of fuel components. Your muscles need the right balance of minerals, specifically magnesium, potassium, calcium, and sodium, to contract and relax properly. When you're deficient in magnesium, your muscles struggle to relax after they contract. Magnesium is like the off switch for your muscles. Without enough of it, your muscles can get stuck in the on position, creating that sustained cramp. Potassium deficiency affects your muscles' ability to respond to nerve signals properly. And calcium deficiency disrupts the entire contraction-relaxation cycle. But here's where it gets interesting. The real game changer isn't just any salt, it's getting back to ancient salt sources. The processed table salt you find in most stores has been stripped of its natural minerals, but real salt, ancient salt from ocean sources, still contains the full spectrum of minerals your body recognizes and knows how to use. When patients start incorporating high-quality, ancient salt into their diet, along with proper hydration, many see their cramps disappear within days. It's not about loading up on sodium, it's about giving your body the mineral balance it's been craving. The second major cause is dehydration, but not in the way you might think. It's not just about drinking 8 glasses of water a day. As we age, our bodies become less efficient at maintaining proper hydration.
Our kidneys don't concentrate urine as well as they used to, and we often don't feel thirsty until we're already significantly dehydrated. When you're dehydrated, your blood becomes more concentrated, which affects how well nutrients and oxygen reach your muscles. This creates the perfect environment for cramping. But here's the key. Proper hydration isn't just about water quantity, it's about water quality and electrolyte balance. Now, let's talk about something that might hit close to home: medication-induced cramps. If you're taking statins for cholesterol, calcium channel blockers for blood pressure, or diuretics for heart health, these medications can significantly increase your risk of muscle cramps. Statins, in particular, can deplete your body's natural Q10 levels and affect muscle function. Diuretics flush out not just excess water, but also essential minerals your muscles need. And calcium channel blockers can interfere with the normal calcium balance in your muscle cells. If you suspect your medications are causing your cramps, don't just stop taking them. Instead, work with your doctor to optimize your electrolyte levels and possibly adjust dosages. Sometimes simple mineral supplementation can allow you to continue your necessary medications without the painful side effects. The fourth cause we need to discuss is circulatory issues. Poor circulation means your muscles aren't getting adequate oxygen and nutrients. This is particularly common in peripheral artery disease, where narrowed arteries reduce blood flow to your legs. But here's something important. If your cramps are accompanied by numbness, tingling, or weakness, or if they're getting progressively worse, this could indicate more serious circulation problems. These symptoms warrant immediate medical attention, as they could signal blocked arteries or even blood clots. The fifth factor is muscle overuse or fatigue. Maybe you had a particularly active day gardening, playing with grandchildren, or taking a longer walk than usual. When muscles are fatigued, they're more prone to cramping because they're running low on energy stores and may have accumulated metabolic waste products. But here's what's interesting. Regular, moderate exercise actually helps prevent cramps by improving circulation and muscle conditioning. It's the sudden increases in activity that tend to cause problems. Now let's move into the solutions that can transform your night and your quality of life. The first and most powerful intervention is optimizing your salt intake with real, ancient salt. I'm talking about salt that comes from ancient ocean sources, not the processed table salt that's been stripped of its minerals. This salt contains over 80 trace minerals that your body recognizes and can use immediately. Start with a pinch of this ancient salt in a glass of water first thing in the morning. This isn't just about sodium, it's about providing your muscles with the full spectrum of minerals they need for proper function. Many of my patients are amazed at how quickly their nighttime cramps disappear when they make this simple change. The second solution is targeted mineral supplementation. Magnesium glycinate is particularly effective because it's highly absorbable and gentle on your stomach. Start with 200-400 milligrams before bedtime. Potassium is trickier to supplement due to regulations, but you can increase it through foods like avocados, sweet potatoes, and white beans. For calcium, don't just grab any calcium supplement. Look for calcium bisglycinate or calcium citrate, which are more easily absorbed than calcium carbonate. And here's a crucial point. These minerals work synergistically. You need the right balance, not just high doses of one. The third solution is strategic hydration. It's not just about drinking more water. It's about drinking the right water at the right times. Upon waking, drink a glass of water with a pinch of that ancient salt. This helps rehydrate your body and replenish minerals lost during sleep. Throughout the day, sip water consistently rather than gulping large amounts at once. Your kidneys can only process about 8 ounces per hour efficiently. If you're drinking a lot of plain water, you might actually be diluting your electrolytes further. The fourth solution is gentle, targeted stretching. But here's the key. Don't wait for a cramp to start stretching. Incorporate calf stretches, hamstring stretches, and gentle ankle circles into your daily routine. Spend just 5 minutes before bed doing these gentle movements. It's like giving your muscles a roadmap for how to relax. When a cramp does hit, remember this. A stretched muscle cannot stay cramped. Gently stretch the affected muscle while applying heat. A warm, wet towel or heating pad can help relax the muscle and increase blood flow to the area. The fifth solution addresses the dietary factors that might be contributing to your cramps. Foods high in arachidonic acid, like fatty meats and certain seafoods, can increase inflammation and potentially trigger cramps in some people. Meanwhile, foods rich in natural electrolytes, like leafy greens, nuts, and seeds, can help prevent them. If you're following a low-carb or ketogenic diet, you're at higher risk for cramps because these diets have a diuretic effect, causing you to lose both water and electrolytes more rapidly. In this case, you'll need to be extra vigilant about mineral and fluid replacement. Now let's talk about when you should seek medical attention, because while most cramps are harmless, some can indicate serious underlying conditions. Seek immediate medical care if your cramps are accompanied by swelling, redness, or warmth in your leg, especially if you've been sitting for long periods or have recently had surgery. These could be signs of a blood clot, which is a medical emergency. Also, consult your doctor if you have cramps that are severe, frequent, or getting worse over time. If they're interfering with your sleep multiple times per week, or if you're developing weakness in the affected muscles, these warrant professional evaluation. Your doctor might recommend tests like a venous Doppler ultrasound to check for blood clots, or an ankle brachial index to assess circulation. These are simple, non-invasive tests that can provide valuable information about your vascular health.
For those of you dealing with medication-induced cramps, work with your healthcare provider to optimize your treatment. Sometimes switching to a different statin or adjusting the timing of your medications can make a significant difference. Other times, adding targeted supplementation can allow you to continue your necessary medications without the painful side effects. Here's what I want you to remember. Your body has an incredible capacity for healing and adaptation, even as we age. Those painful nighttime cramps that have been disrupting your sleep and stealing your peace of mind, they don't have to be your reality. When you address the root causes we've discussed today, optimizing your electrolyte balance with ancient salt, ensuring proper hydration, supporting your muscles with targeted nutrients, and incorporating gentle movement, you're not just treating symptoms. You're giving your body the tools it needs to function optimally. This isn't just about avoiding pain. It's about reclaiming your confidence, your sleep, and your ability to fully embrace life. It's about being able to take that evening walk without worry, to play with your grandchildren without hesitation, and to wake up each morning feeling refreshed and ready for whatever the day brings. Remember, every small step you take toward better health is an investment in your future. Your commitment to understanding and addressing these issues shows incredible wisdom and self-care. You're not just improving your own quality of life, you're setting an example for your children and grandchildren about what it means to age gracefully and powerfully. If you found this information helpful, I'd love to hear about your experiences. What has worked for you in managing muscle cramps? What questions do you still have? Your insights and stories not only help me create better content, but also help other viewers who might be going through similar challenges. And if you're ready to take control of your health and continue learning evidence-based strategies for aging vibrantly, consider subscribing to our channel. This is where we dig deep into the real solutions that can transform your golden years from years of limitation to years of possibility and joy. Remember, you're never too old to feel strong, comfortable, and confident in your own body. Your best days aren't behind you, they're ahead of you. And they start with the choices you make today.